Medicare Advantage plans are bad. Or are they? In today's video, we're going to talk about the pros and cons of Medicare Advantage plans. It's not a simple yes, Medicare Advantage plans are bad, or no, they're not bad. Actually, they're not bad. In today's video, I'm going to give you the pros and cons so that way you make an informed decision on what's best for your particular needs. Hello there, welcome back to the channel. My name is Patricia. Please give this video a big thumbs up so more people can find this video. Let's get started. So it's very important to take these key notes when you're shopping or thinking or considering about Medicare Advantage plans, because this is the truth. About 45% of Americans are on Medicare supplement plans, and about 45% are on Medicare Advantage plans. And we have about 10% that is on original Medicare without any supplement, which I do not recommend. Or maybe they have Medicare and Medicaid, and that is it. So in today's video, we're going to focus on Medicare Advantage plans, pros and cons. Before we start with that, let's talk about what is very important for you to have on your checklist when you are considering looking at Medicare Advantage plans. Number one, your doctors. Are your doctors and networks? There are so many different options when it comes to Medicare Advantage plans, so you definitely want to look at your doctors, what plans they take. So that is the most important thing. Look at your primary care doctor. Don't forget about your specialist, your eye doctor, your dentist. Look at all of your doctors and see if they are in network with these different plans. The second thing you want to look at is your medications. How much are your medications? Where do you fill your medications? What pharmacy? So it's very important to know your medications and the cost of these medications. All right, first we're going to talk about the pros and we're going to talk about the cons. Let's start with the pro. Okay, pro number one is I believe that the Medicare Advantage plans are cost efficient. Instead of paying an extra monthly premium for a Medicare Advantage plan, you actually have co-pays. So you use the plan as you go. Another pro is that these plans has extra perks, extra benefits that original Medicare does not have, such as dental, vision, hearing, transportation, and so many other perks. So it is nice to have an all-in-one plan where you can go to the dentist, go to the eye doctor, and even pick up your medications. A lot of these Medicare Advantage plans also include prescription drug coverage. So that is definitely a plus. Now let's take a quick moment here to talk about networks. Okay, so we have your HMO networks, you have your PPO networks. So what's the difference? So if you're on a HMO network, you have to stay within network. You have to go to doctors that are in network. If you go outside of the network, then you will pay full price for those physicians, okay? So you have to stay within network. Also, with an HMO plan, you need a referral to see a specialist from your primary care physicians. Now, generally, if you're on a HMO plan, you get more benefits, but you have to stay within network, so more dental, vision, and hearing benefits. Now, let's talk about the PPO. With a PPO plan, you can go outside of the network, but you're going to pay more for those doctors outside of that network. You do not need a referral to see a specialist, and you usually get less benefits, less, dental, vision, and hearing, because you do have, more options to see doctors. Now, whether you have an HMO plan or a PPO plan, you can go outside of network for emergency reasons, okay? So say you're traveling and you have an emergency, like die or death emergency, you go to the emergency room or you see a doctor outside of the network, then in that case, your plan will cover that visit. Let's talk about our cons. We talked about all the good. Now we're gonna talk about the cons, okay? Con number one is pre-authorization. So what is pre-authorization? So in certain situations, certain tests, certain treatments, you will have to get pre-authorization. You will have to get the okay for the insurance carrier to go ahead and pay for that treatment or for that surgery or for that service, whatever it is, you may have to ask for permission. Your doctor will have to send a letter to the insurance company and say, hey, this is medically necessary. My client, my patient need this service. And you have to wait for the insurance company to say yes. Or you may have to do step therapy. Try this before you do this. For an example, say you're having pain in your hip and your doctor say you need surgery on this hip. The insurance company may say, you know what? Do therapy first or do this first or whatever the case may be. So that is a con. Sometimes you do have to deal with pre-authorization. Now, con number 2 is that you do have to stay within network, okay? That is the pain that individuals may not like. But hey, if all your doctors are in network, then it's really not a big deal. But that is a con, so I have to add that. You do have to stay within network. You cannot travel with a Medicare Advantage plan. Now, however, there are some PPO Medicare Advantage Plans or even HMO Medicare Advantage Plans where you can travel with this benefit. You would have to ask your insurance carrier if they have that benefit. You usually would have to notify them. For an example, say you're going to New York to get some treatment done, right? You have to let your insurance carrier know that, hey, I'm going to use my travel benefits, right? And I'm going to be in New York for this amount of months for this treatment, and they can okay it. But only certain plans have this travel benefit, okay? So it is a con that you cannot just go to any doctor that takes original Medicare. It does not work that way. That's how a Medicare supplement plan works. So that is a con that you do have to stay within doctor networks. Even if you have a PPO plan, the doctors still have to be willing to accept that PPO plan to take that insurance plan as a payment. Alrighty, so I hope I made it really clear when it comes to Medicare Advantage plans, the pros, the cons. Are they bad? Are they good? I'm going to tell you this, Medicare Advantage plans are not bad. It's just very important for you to take the checklist provided in this video and make sure that all of the pieces are, hitting the puzzle. Your doctors, your medications, special treatments such as, home health, dialysis, oxygen, all of that. Is your doctor in network? Put all those pieces together and you should be fine. Thank you so much for watching this video. If you need any assistance, give our office a call. We'd be more than happy to assist you. I'll leave my number right here. Yeah, give us a call. We help our clients with Medicare, Marketplace health insurance, plan enhancers, plans that enhances your health insurance policy. Thank you so much for watching. Don't forget to like, comment, share this video, and subscribe. Why not? It's free. Thank you so much for watching. Bye.